The Posey Bed 8070 is a passive alternative to direct restraints, such as belts, vests, or jackets. However, it is still a restraint and must be prescribed by a licensed physician. Safe and effective use of the Posey Bed requires that the physician and all caregivers be aware of and heed the following instructions. This information is also available in printed form in the user manual or online at www.posey.com. Indications and intended use. The Posey Bed is a passive restraint for adult and pediatric patients at least 46 inches tall, weighing between 46 and 300 pounds. It is designed to help prevent unassisted bed exit for patients at extreme risk of injury due to a fall, including patients with severe osteoporosis, severe risk of fractures due to clinical conditions, insufficient muscle, fat, and subcutaneous tissue to absorb the impact of a fall, current use of anticoagulants, a history of severe trauma in a prior fall. Clinical conditions. Certain at-risk patients may also benefit from the use of the Posey Bed. These include patients with behavioral, physical, mental, or other symptoms identified by a physician or the interdisciplinary health team, IDHT, such as musculoskeletal problems that cause an unsteady gait or impair strength or biomechanics, altered awareness due to medication or neural illnesses that impair alertness and balance, and/or dementing illnesses, visual or peripheral neuropathies that impair positional sense. Approved care plan. Each patient must have an approved care plan prior to using the Posey Bed. The Posey Bed should only be used in accord with all state regulations, all Federal Center Medicare and Medicaid Services, CMS regulations, the patient's care plan, the policies of your facility, and the physician's orders. Contraindications when not to use the Posey Bed. The Posey Bed is not intended for use with patients who weigh less than 46 pounds or are shorter than 46 inches. These patients are at risk of severe injury or death, and the Posey Bed 8070 has not been tested for use by such patients. Patients who weigh more than 300 pounds. This is the maximum load capacity of the bed. Patients diagnosed with any condition that may cause violent or self-destructive behaviors. These could result in self-injury and/or damage the Posey Bed. Violent flailing of the body from side to side could cause the Posey Bed to tip over or move to a position where the patient is injured by contact with an object in the room. Patients with an excessive pica eating disorder. Patients who are or who become claustrophobic while in the Posey Bed. Due to the nature of some patients' diagnosis, activity level, or uncontrolled movements, the Posey Bed is not suitable for every patient. Benefits and risks. The Posey Bed was designed to help provide these benefits: a controlled patient environment, calming effect for some patients, reduce the risk of unassisted bed exit, reduce the risk of patient falls, avoid the risk of a patient being trapped under a mattress, and eliminate the need for side rails. This avoids the risk of a patient being trapped in side rails or between the mattress and side rails. Improper use of the Posey Bed may lead to serious injury or death. Patient monitoring should be established by hospital protocol and the patient's care plan. See the warnings section in the user's manual, pages 9 through 11, to help reduce or avoid these risks: entrapment, suffocation, choking, and patient falls. Reassessment. Reassess the need for use of the Posey Bed as the patient's mental or physical health or status changes. Use the Posey Bed only if there is no less restrictive alternative. Use the least restrictive device for the shortest time while you seek a less restrictive alternative. Adverse reactions. Although it is a passive restraint, use of the Posey Bed could cause emotional, psychological, or physical problems in certain patients. These include a significant change in mental status, such as claustrophobia or depression, sudden mood changes which lead to a change in medical condition, an increase in aggression or self-destructive behaviors, Get help from the physician or the IDHT if symptoms of any of these appear and do not improve as the patient becomes used to the Posey bed. You may need to find alternative methods of treatment. Adverse events. Any injury to a patient or caregiver that may relate to use of the Posey bed, as well as any product malfunction, should be reported to Posey as soon as possible, but no later than 5 business days after the event. Also, we want to hear from you about any activity or type of product use that you feel may cause a risk of injury or product malfunction. Please provide details about any injury, malfunction, or other concern. Known and possible adverse events involving bed enclosure systems include, but are not limited to, one or more of the following, whether or not there is injury to a patient or a caregiver. Risk of entrapment from patient condition, bed position, or activity level which may lead to suffocation. A fall due to a broken or damaged zipper or torn canopy. A patient being able to open a panel or port zippers. A fall during patient care while a panel is open. Unexpected movement of the bed when the casters are locked and the transfer brakes engaged. Impeded flow of tubes or lines. Skin irritation from contact with bed fabric or from excessive rubbing behavior. Breathing problems which may lead to suffocation due to entrapment with the canopy material or a mattress inside the bed enclosure. Use instructions, warnings, and cautions found in this manual, on the in-service DVD, and on labels sewn to the Posey bed are intended to help avoid or reduce the possibility of these and other adverse events from occurring. Be sure to report any safety or performance issue, product malfunction, or possible risk of injury or malfunction involving the Posey bed. Risks and benefits, alternatives to restraint use. Review the patient's mental and physical status often to ensure that the benefits of using the Posey bed as a restraint outweigh the risks. Safe use requires that you define and remove, if possible, the cause of the symptoms that require a restraint. This may include catering to individual needs and routines, increased rehabilitation, restorative nursing, modifying the environment, or increased supervision. You tailor interventions to the individual needs of the patient after weighing factors such as the patient's condition, behaviors, history, and environment. When possible, enlist the aid of family members. Depending on the patient's condition, alternatives to restraint may include one or more of these: fall alarms, floor cushions, lowering the volume on the TV, adjusting window shades or dimming lights, soft music, use of a Posey activity apron. As with all restraints, the Posey bed should never be used for nursing convenience. Caregiver training. Make sure that each caregiver is fully trained before use of the Posey bed. Review and follow all use instructions and warnings and cautions as they appear in this video, the user manual, and the labels sewn to the Posey bed. Posey recommends that you review them weekly during the first month. Review them at least once a month thereafter until they become second nature to you. For future use and quick reference, keep all Posey bed instructions and the in-service DVD in the pocket at the foot of the bed. For assistance with the Posey Bed 8070, contact Posey Technical Service toll-free at 1-800-44-POSEY, at 1-800-447-6739. All product instructions as well as this in-service DVD are available free of charge. At your request, these can be sent to you by overnight delivery, or you can download instructions or view this video by visiting our website at www.posey.com. Thank you for choosing the Posey Bed 8070 bed enclosure system. This video was designed for the training of institutional caregivers in a licensed nursing home or hospital. The 8070 integrates a hospital bed, mattress, and canopy into a single system, designed to provide a safe, controlled environment for patients at extreme risk for injury from a fall or unassisted bed exit. And while the Posey Bed is a passive alternative to direct physical restraints, such as belts, vests, or jackets that attach to the patient, it's still a restraint adjacent to a patient and a medical device that must be prescribed by a licensed physician. And as with any restraint, the Posey Bed must never be used for nursing convenience. Before using the Posey Bed, all caregivers should review this video and read the user's manual in its entirety. Please pay particular attention to the sections entitled Indications for Use and Contraindications when not to use the Posey Bed. It is extremely critical that you read and familiarize yourself with this data. Recognize again that the Posey Bed is a passive restraint for adult and pediatric patients at least 46 inches tall, weighing between 46 and 300 pounds. On this DVD, you'll find a chapter on the menu that details all of this information, as well as other critical safety information. Be sure to review it here in its entirety. To help these procedures become second nature, Posey recommends that you review these tools once a week during the first month of use, and at least once a month thereafter. Be sure to call Posey Technical Service if you have any questions about these instructions or safety warnings. Now, when we refer to a warning in this video, it alerts you to a safety hazard or unsafe practice, which, if not avoided, could result in serious injury or death. When the word caution appears, it alerts you to a hazard which, if not avoided, may result in minor or moderate injury to you or the patient, or damage to the Posey Bed. At the close of this video, you should have an understanding of the following: the parts and features of the Posey Bed, using the Posey Bed in a healthcare setting, reducing the risk of entrapment and other risks, and the importance of patient monitoring.